Hello, I'm Dr. Robert Clark. Let me ask you a question that could save your life. Did you know that having diabetes more than doubles your risk of developing heart disease? And, perhaps more frighteningly, the warning signs often don't shout. They whisper. For many, they're completely silent until it's too late. It's a harsh reality, but one we must face together. There's a sobering statistic from the American Heart Association that I share with my patients because it underscores the urgency of this topic. Over two-thirds, a staggering 68%, of adults with diabetes over the age of 65 will ultimately die from some form of heart disease or stroke. This isn't meant to scare you, but to empower you. Knowledge is the first step toward taking control. You're not alone in this, and the good news is that there are clear, powerful steps you can take to protect yourself. In our time together today, we're going to walk through this connection step by step. First, we'll uncover exactly why diabetes puts your heart at such a high risk. Second, we'll learn the specific warning signs to watch for, both the obvious and the subtle ones that are often missed. Third, we'll discuss the practical lifestyle changes that can act as a shield for your heart. And finally, we'll outline a dual management strategy to tackle both conditions head-on. By the end of this video, you'll have a clear roadmap to a healthier future. So, let's start with the most fundamental question. Why is this connection so strong? What is it about diabetes that makes it such a formidable threat to your cardiovascular system? It begins at the molecular level, with your blood sugar. When blood glucose levels are consistently high, your blood essentially becomes toxic to the very vessels that carry it. Think of your arteries and veins as a network of smooth, flexible pipes. High blood sugar acts like fine grit sandpaper, constantly scraping and scoring the delicate inner lining of these pipes, a layer called the endothelium. Over months and years, this relentless damage creates rough, inflamed patches. These damaged areas are like magnets for cholesterol and other fatty substances floating in your bloodstream, which then begin to stick and accumulate. This process is called atherosclerosis, or the hardening of the arteries. It's a slow, silent progression that narrows the passageway for blood flow, forcing your heart to work much harder to pump blood throughout your body. I remember a patient of mine, a gentleman named George. He was in his late 60s, a retired schoolteacher who was diligent about checking his A1C. But for years before his diagnosis, his blood sugar had been creeping up, what we call pre-diabetes. He thought that because he finally got his numbers under control, he had dodged the bullet. What he didn't realize was that the subtle, sandpaper-like damage had been happening for a decade. The warning shot came in the form of chest pain while gardening. His arteries were already significantly narrowed. This illustrates a crucial point. Managing diabetes is not just about the number on your glucose meter today. It's about preventing the cumulative damage that can happen over a lifetime. So, I ask you this. Have you considered that the tingling you might feel in your feet, a common sign of diabetic nerve damage, could be a small-scale sign of the very same damaging process happening inside the vital arteries of your heart? Beyond the direct physical damage from sugar, there's another, more insidious process at play: chronic inflammation. Now, when we hear the word inflammation, we usually think of a sprained ankle. It gets red, swollen, and hot as the body rushes resources to heal it. That's acute, helpful inflammation. But the inflammation caused by diabetes is different. It's a low-grade, systemic fire that smolders silently throughout your entire body, day in and day out. High blood sugar and excess body fat, particularly around the midsection, act as fuel for this fire. This constant state of alert puts immense stress on your organs, and the heart and blood vessels are on the front lines. This internal fire makes the damaged artery walls I just described even stickier. It sends out signals that attract more white blood cells and cholesterol, accelerating the buildup of those dangerous plaques. Let me tell you about another one of my patients, a wonderful woman named Susan. Susan was on medication for her type 2 diabetes and felt she was managing it well. However, her diet was still heavy in processed foods, sugary drinks, and unhealthy fats. She told me, "Dr. Clark, my pills take care of the sugar, so I can be a little flexible, right?" What she didn't grasp was that while her medication helped control her glucose numbers, her diet was continuously feeding that low-grade inflammatory fire. She felt a persistent, deep fatigue she blamed on getting older. But it was more than that. It was the whisper of her body working overtime to fight this constant inflammation. One day, she came to my office with shortness of breath after just walking up a single flight of stairs. An evaluation revealed significant plaque buildup in her coronary arteries, far more than we would have expected for her age. Her case was a powerful lesson that diabetes management is not just about medication, it's about extinguishing the inflammatory fire through a healthy lifestyle. Think of it like this: your body is a high-performance engine. High blood sugar is like putting the wrong kind of fuel in the tank, causing it to sputter. But chronic inflammation is like running that engine in the red zone, 24 hours a day. Even with the right fuel, the constant stress will wear down the components prematurely. Your heart is that engine, and it can only take so much strain. I'd like you to ask yourself, are there foods in your diet, like processed snacks or sugary beverages, that might be fanning the flames of inflammation? Finally, we have to talk about the company diabetes keeps. It rarely travels alone. This brings us to the third major reason for the heightened risk: a cluster of shared risk factors. Think of it as a gang of troublemakers working together to damage your heart. The main culprits are high blood pressure, unhealthy cholesterol levels, and excess weight, especially obesity. In the medical community, we call these comorbidities, and when they team up with diabetes, their destructive power doesn't just add up, it multiplies. High blood pressure, or hypertension, is like a constant pressure washer blasting against those already damaged and inflamed artery walls we discussed. This relentless force accelerates the formation of plaque and can even cause pieces to break off, leading to a heart attack or stroke. Unhealthy cholesterol, specifically high levels of LDL or bad cholesterol, provides the sticky, fatty raw material that builds these blockages, and obesity, particularly abdominal fat, is a factory for the inflammatory substances that fuel this entire dangerous process. I had a patient, Frank, a retired firefighter who was a big, strong guy. He was focused on losing 20 pounds, which was a great goal. But he kept dismissing his blood pressure readings, saying, "It's just a little high, doc. It's borderline." He saw his weight, his blood pressure, and his cholesterol as 3 separate items on a checklist. We had to sit down and reframe his thinking. I drew him a diagram showing how these 3 factors were launching a coordinated, 3-pronged attack on his heart, all made worse by his diabetes. It was a wake-up call. He started to see them not as individual problems, but as one single, interconnected threat to his future. He finally understood that you cannot isolate one from the others. Have you ever fallen into that trap of focusing on one number, like the number on the scale or your A1C, while letting others, like your blood pressure, slide? Now that we have a clear picture of why the risk is so profoundly elevated, we must turn our attention to an equally critical topic: learning to recognize the warning signs. And this is where things can get tricky for people with diabetes. Your body has an alarm system for when the heart is in trouble, but diabetes can, in effect, rewire or even disable that system. The classic textbook sign of a heart problem is, of course, chest pain, what doctors call angina. This is often described as a pressure, squeezing, or fullness in the center of the chest. But for many diabetics, this alarm bell may never ring. Years of high blood sugar can damage the nerves that carry pain signals from the heart to the brain, a condition known as diabetic neuropathy. This can lead to something we call silent ischemia, where your heart muscle is being starved of oxygen-rich blood, but you feel little to no pain. It's like having a fire in your house, but the wires to the smoke detector have been cut. The danger is real and escalating, but the warning system is offline. This is why you cannot afford to wait for crushing chest pain to tell you something is wrong. We have to learn to listen for the whispers, not just the shouts. So, if we can't always rely on chest pain, what are these other, more subtle signals? These whispers from the heart? One of the most common is shortness of breath, especially during mild activity. This isn't the huffing and puffing you get from a strenuous workout. This is feeling winded after doing something that used to be easy, like making the bed or walking up a flight of stairs. When your heart muscle isn't getting enough blood, or isn't pumping effectively, blood can back up into the vessels in your lungs. This pressure causes fluid to leak into the lung tissue, making it feel like you can't get a deep, satisfying breath. It's your body's way of telling you that the system is under strain. The next sign to be highly aware of is unusual or extreme fatigue. I'm not talking about feeling a little tired at the end of a long day. This is a profound, bone-deep weariness that isn't relieved by a good night's sleep. Many of my patients dismiss this, saying, "Well, I'm just getting older, Dr. Clark. I had a patient, Eleanor, a vibrant woman who loved her book club and gardening. She started canceling on her friends because she was just too exhausted. Her family noticed she was napping for hours every afternoon. She was convinced it was just her age catching up with her, but her daughter insisted she come in for a checkup. We discovered her heart was working incredibly hard to compensate for a significant blockage. Her fatigue was a direct result of her heart being unable to pump enough oxygenated blood to the rest of her body. Her body was in a constant state of energy crisis. Once we treated her heart condition, she told me she felt 20 years younger. So please, I urge you, do not write off profound fatigue as just a normal part of aging. It can be your heart's primary way of crying out for help. Other subtle signs include dizziness, lightheadedness, or feeling like your heart is fluttering or skipping beats. These can be signs of an arrhythmia or an irregular heartbeat, which is often complicated by a struggling heart muscle. Swelling in your feet, ankles, or legs is another critical red flag. When the heart can't pump strongly enough, it has trouble moving blood back up from the lower parts of your body. Fluid can then pool in your tissues, causing this swelling, which we call edema. You might notice your socks leaving deep indentations at the end of the day, or your shoes feeling unusually tight. This is often an early sign of heart failure, a condition where the heart can no longer pump efficiently enough to meet the body's needs. Finally, and this is particularly important for women, heart distress can manifest as nausea, indigestion, or a feeling of fullness or pain in the upper abdomen, similar to heartburn. Because of how our nerves are wired, the brain can misinterpret pain signals from the heart as coming from the stomach. The key with all of these symptoms is to notice what's new or different for you. A single instance might not be cause for alarm, but a pattern or a combination of these signs is your body's clear signal to get checked out immediately. Hearing all of this information about risks and warning signs can feel overwhelming, I know. It can feel like you're fighting a battle on two fronts. But now, I want us to shift our focus from the problem to the solution. This is the most important part of our conversation because this is where you take back control. The good news, the truly wonderful news, is that your daily choices have an immense power to protect your heart, often more powerful than any prescription I could write. We're going to talk about the practical, sustainable lifestyle changes that can build a powerful defense for your cardiovascular system. Let's start with what's on your plate. The single most effective way of eating for both diabetes and heart health is the Mediterranean diet. Now, please don't let the word diet scare you. This isn't about deprivation or complicated rules. It's a pattern of eating based on whole, delicious foods. Think of it as adopting a new, healthier philosophy of food. It emphasizes fruits, vegetables, whole grains, beans, nuts, and legumes. It uses healthy fats like olive oil instead of butter and encourages eating fish and poultry over red meat. Why is this so powerful? Because these foods directly counteract the damaging processes we talked about earlier. The healthy fats in olive oil and fatty fish like salmon are profoundly anti-inflammatory. They help to extinguish that low-grade fire inside your arteries. The fiber in whole grains, fruits, and vegetables helps to control blood sugar, lower cholesterol, and keep you feeling full, which aids in weight management. I often think of a patient named Maria. When I first mentioned the Mediterranean diet, her face fell. She said, "Dr. Clark, I'm 72 years old. I can't learn a whole new way to cook now. It's too much." I told her, "Maria, let's forget the diet. Let's just make one small change this week." Her first change was simple. She switched from using butter to cook her eggs to using a little bit of olive oil. The next week, she swapped her usual afternoon snack of crackers for a handful of almonds. The week after, she added a simple side salad to her dinner. These weren't drastic changes. They were small, manageable steps. But over 6 months, those steps added up. She lost 15 pounds, her blood pressure improved, and for the first time in years, her A1C dropped below 7%. She had more energy and, most importantly, she felt empowered, not deprived. So I ask you, what is one small swap you could make this week? Could you have fish for dinner one night instead of steak? Could you reach for an apple instead of a cookie? Every small choice is a vote in favor of your heart. Hand in hand with a healthy diet is our next pillar of protection, physical activity. For many, the word exercise brings to mind images of strenuous, exhausting workouts at a gym, and that can be intimidating. So, I prefer to use the word movement. Our goal is to find ways to move our bodies consistently and joyfully. The American Diabetes Association recommends 30 minutes of moderate-intensity activity, like brisk walking, 5 days a week. And here's a wonderful secret. You don't have to do it all at once. 3 10-minute walks spread throughout your day are just as beneficial as one 30-minute session. When you move your body, magic happens. Your muscles become more sensitive to insulin, which means your body can use blood sugar more effectively, naturally lowering your levels. Your heart, which is a muscle after all, gets stronger and becomes a more efficient pump, reducing your blood pressure. I had a patient, a gentleman named Bill, who would cross his arms and shake his head every time I brought up exercise. "Doc," he'd say, "I was a mailman for 40 years. My walking days are over." He had a mental block against the idea. So we reframed it. I asked him, "Bill, could you just walk to your mailbox and back twice a day?" He grumbled, but he agreed. After a week, he said it was too easy. So we changed the goal to walking to the end of the block. A few weeks later, he struck up a conversation with his neighbor, who also needed to be more active. They started walking together every morning. It stopped being a medical chore and became a social outlet. They explored different parks. They talked. They laughed. Bill lowered his A1C and his blood pressure, but he told me the best part was that he no longer felt so isolated. Find something you enjoy. It could be dancing to your favorite music in the living room, water aerobics at the community pool, or gentle stretching. The best activity is the one you'll actually do consistently. This brings us naturally to weight management. Carrying excess weight, especially around your abdomen, puts a direct physical strain on your heart and acts as that factory for inflammation we spoke of. The good news is that you don't need to achieve some unrealistic weight loss goal to see profound benefits. Losing just 5% to 10% of your body weight can have a massive impact. For a person who weighs 200 pounds, that's just 10 to 20 pounds. That modest amount of weight loss can dramatically improve your blood sugar control, lower your blood pressure, improve your cholesterol levels, and take a significant workload off your heart. It's one of the most powerful things you can do for your long-term health. Notice how these pillars work together. When you adopt a Mediterranean style of eating and incorporate more movement into your day, weight loss often happens as a natural, positive side effect. It's not about crash dieting, it's about building a healthier lifestyle, one brick at a time, that supports all aspects of your well-being. What is one form of movement, no matter how small, that you could add to your routine this week? The final pillars of lifestyle change are managing stress and, if you smoke, quitting immediately. Let's talk about stress reduction. We live in a stressful world, and it's easy to dismiss stress as just a part of modern life. But chronic stress has a direct physical impact on your body. When you're stressed, your body releases hormones like cortisol, which can directly raise your blood sugar and blood pressure. It's part of the fight or flight response. But when that response is activated day after day, it contributes to that same chronic inflammation that damages your arteries. Learning to manage stress is not a luxury, it's a medical necessity. I had a patient, David, who was the model patient on paper. He changed his diet, he walked every day, but his blood pressure remained stubbornly high. When we talked, I realized he was a chronic worrier. He'd watch the news for hours, fretting about the state of the world and constantly stewing over finances. His body was in a permanent state of high alert. Together, we worked on a plan. He started a simple practice of taking 5 deep, slow breaths whenever he felt his anxiety rising. He replaced his evening news habit with listening to calming, classical music. It sounded small, but the effect was profound. By consciously activating his body's relaxation response, he was able to lower his cortisol levels. And within a month, his blood pressure readings finally started to come down into a healthy range. Finding what works for you is key. It could be prayer, meditation, spending time in nature, talking with a friend, or engaging in a hobby you love. It's about intentionally building moments of peace into your day to counteract the physiological impact of stress. Now, I must be very direct about our final lifestyle point: quitting smoking. If you have diabetes and you smoke, there is no other single change you can make that will have a more dramatic and immediate positive impact on your heart health. To put it plainly, smoking is like pouring gasoline on the fire of diabetes. It catastrophically multiplies your risk. It directly damages the lining of your blood vessels, makes your blood stickier and more likely to clot, lowers your good HDL cholesterol, and reduces the amount of oxygen that gets to your heart. It accelerates every single negative process we've discussed today. Quitting is difficult, I know, but you do not have to do it alone. Please talk to your doctor. There are so many effective tools now, from nicotine replacement therapies to support groups and medications. It is the most important promise you can make to your heart. Lifestyle is your foundation. Now let us build the house on top of it by discussing how to work with your healthcare team for optimal dual management. To make this simple, we use the ABCs of protection. These are the 3 critical numbers you must know, track, and manage. A is for A1C. This is a measure of your average blood sugar control over the past 2 to 3 months. For most people with diabetes, the target is to keep this number below 7%. Keeping your A1C in check is the first line of defense in preventing that sandpaper damage to your blood vessels. B is for blood pressure. As we've discussed, high blood pressure puts a constant, damaging strain on your heart and arteries. The target for most people with diabetes is to keep blood pressure below 130/80. Achieving this goal often requires a combination of lifestyle changes, like a low-sodium diet and regular exercise, and sometimes medication. Consistent monitoring at home with a reliable cuff is one of the best ways to help your doctor fine-tune your treatment. And C is for cholesterol, specifically LDL, the bad cholesterol. This is the waxy substance that builds up in your arteries. The goal here is to get this number low, generally under 100, and for some high-risk individuals, even under 70. This is often managed with diet and, in many cases, with highly effective and safe medications like statins. Knowing and managing these 3 numbers, your ABCs, is the cornerstone of preventing diabetic heart disease. Beyond the ABCs, true dual management requires integrated care. This means all your doctors need to be on the same page. Ensure your primary care doctor, your heart specialist or cardiologist, and your diabetes specialist or endocrinologist are communicating with each other. It's also vital to coordinate your medications. Many drugs can interact, so your healthcare team needs a complete picture of everything you're taking, including over-the-counter supplements. And finally, don't forget your kidneys. Diabetes is the leading cause of kidney disease, and your heart and kidneys are intimately linked. When your kidneys aren't functioning well, they can't regulate fluid and blood pressure effectively, which puts enormous strain on your heart. Ask your doctor for a simple annual blood and urine test to check your kidney function. It's a critical piece of the puzzle. So, where do we go from here? I know we've covered a tremendous amount of information, but I want you to leave here today feeling not fearful, but empowered. The connection between diabetes and heart disease is a formidable one, but it is not a foregone conclusion. You are in the driver's seat. Through the powerful choices you make every single day, the food you eat, the way you move your body, the way you manage stress, and by working closely with your healthcare team to manage your ABCs, you can reduce your risk to a level that is near normal. You have the power to change your future and protect the health of your heart for years to come. Your first step starts today. My call to action for you is simple. Schedule a comprehensive checkup with your doctor to specifically discuss your heart disease risk and create a personalized protection plan. Know your numbers. And please, help spread this life-saving information by sharing this video with friends or family members who are living with diabetes. Thank you for your time and your commitment to your health. Be well.